Yes.
Yeah,
Okay, awesome, guys. I think
we can get started.
we should quickly jump into the session. We have most people here. It was a good start knowing everybody's stories. Before I get Mithun to continue on this, just few things. The chat is always open. You have any questions, please go ahead and write your questions. We'll try and take and answer each one of them as we go along. What we usually try and do that we take the questions when we are covering a particular topic in a slide, but if we feel that that particular question will be answered later in the presentation, we'll keep it for later. So don't worry, your question will be answered. If not, then maybe a bit later. Towards the end of the session, we're going to open the floor for discussion and questions again. You can unmute yourself, raise your hand, unmute yourself, talk about it, talk about your issues, talk about your questions, or you can use the chat feature. We have two people leading the session for us today. Mithun is actually going to lead the session, and Dr. Chinar is going to answer all vet-related allergy and intolerance questions. and so we have two experts here helping us with this session. And so a quick introduction about Mithun. Mithun is a certified canine nutritionist. Did everybody see the slide change?
Yes, yes.
Yes, okay. He's a certified canine nutritionist. We've been working very closely for over a year. He's also the founder of Crypto's Canine Nutrition. And for any meal plans, for any advice on nutrition, Mithun is your go-to person. So over to you, Mithun. I think we can quickly start with what you're planning to cover in this session, and then we can jump into topic number 1.
Okay, hello everyone. My name is Mithun. As Mansi introduced, I'm a certified canine nutritionist, and I'll be taking all your questions and basically guiding you everything you need to know about what is allergies, how do you deal with this, and trust me, this is one of the most complex topic you can ever imagine, and I'm trying to cover up a lot of things which I can help you out to understand and basically help your dog out. So we'll be discussing about food intolerances and allergies to begin with, and then we'll be discussing. So I took the liberty of going in a little bit deeper in terms of environmental allergies also, and basically because it is so much interrelated and it gets very confusing to deal with whether it's food allergies or environmental. And also, what are the symptoms of allergies? How do you understand the symptoms before you get into treating them? Okay, because you need to understand your dog very clearly before you jump into anything. And this is one very important request from my end, is that please understand that every single dog is completely different, and what will work for one dog would not work for another dog. And it is very important to look at the dog in front of you before you jump into all the powders and every single thing you can ever imagine are there in the market right now, because those have a lot of synergistic and antagonistic reactions which can cause other issues. Okay, and then we'll be discussing how do you manage out the allergies and what are the nutrient concentrations, and then we'll go ahead with your question answers. Okay, Mansi, you can move to the next slide. So this is what we'll be discussing today. So now let us understand what are these allergies and how do they function and how do they react. So basically, an allergy can be anything you can ever imagine. Like in the beginning, as I told, there is a dog who's allergic to dog hair. He sniffs himself and he starts sneezing, and he'll start having all these issues. So allergies are basically an immune system response from the body to any potential allergen. It can be any single thing which could be there. So it starts from any food ingredient. It could be let me go with food first. It could be a meat, it could be an organ, it could be one particular part of a meat protein, because there are dogs who are allergic to chicken breast but not chicken thigh. So it gets so complex, and dealing with allergies would definitely take a very long time. And I request you to, when you're dealing with true food allergies or true intolerances, please go very, very slowly. This is one of my personal tip to you, is that go very, very slowly to understand every single thing, and do not rush into conclusions. You need to go with multiple trials and errors with this, because every dog is different. And now coming back to the grains, as the grains could also be a potential allergen to dogs, but not all dogs are allergic to grains. All dogs are allergic to grains. All dogs are allergic to wheat is one of the very false myth also. because my dog gets quinoa atta rotis made every morning by my cook and my mom. So that's a different story. Anyway, um, and it could be and also parasites mimic a lot of allergy symptoms, and then mosquito bites will cause hives and cause other issues. Any kinds of insects also cause it. And then cement, when, like, let's say for example your dog is on a walk and they walk on cement, cement as in like proper cement which has not been added with water and it's not made as yet, like the dust kind of cement. Okay. They sniff that and they start sneezing, because my dog does that when there was construction happening. He sniffed and he started sneezing. So it could be that some particles went inside the body through the nostrils and it could have been caused that. And even dust. There are dogs who are allergic to dust also. Like many humans are also allergic to dust, for that matter. And now now let's dig deeper. I hope you got a quick preview on what is allergies. Now coming to what is food allergies. Food allergies are, as the name states, it's food allergies. So it can be either to a particular protein structure of the food, any structural, for example, we'll be discussing this in depth when we are discussing nutritional considerations. So there are many times when a dog could be allergic to chicken as a particular protein, and it could be multiple other meats also, and also even vegetables, because there are, you can everywhere you may have read pumpkin is a superfood for dogs. But did you also know that pumpkin is one of the leading allergens in dogs? It is one of the leading allergens in dogs, and allergies manifests in multiple ways. It is not just a dog is itching or licking his paws or anything. It will manifest into a lot of other states, which can even lead to hospitalization of a dog. There have been cases for that. And now coming to environmental allergies. So when any client reaches out to me for a consult, like with skin issues, dogs with skin issues, the first my question is, what is the floor cleaner you use? What is the dishwash cleaner you use to wash your dog's utensils? Because all these Vim drops and all those things, they tend to can potentially cause a reaction. So majority of dogs do not have it, but some dogs do. So when we are tackling sensitive cases, there is a lot of things you have to get in depth with. And then it could be, as I told earlier, dust, grass, etc. And then perfumes, air fresheners which you use in your homes, and even agarbattis, like whenever puja is happening, all these things. The scent, so basically a dog's nose is very sensitive to a human. For example, if you spray an air freshener and that scent is somewhat strong to you, please imagine that this is more than like 10 times more stronger than that smell to your dog, because they have a very sensitive smelling power. Any questions still here? Right, no questions. All right, we can move ahead.
Did the slide change?
Yes, it just did.
Okay.
Okay. No, it went back up. Yes.
Is it?
Yes, it's now at 5, correct?
Yeah.
Okay. So now let us understand what is allergies and what is food intolerances. So both of them are very different terms, and allergies is particularly a very strong term to use to any for a particular matter. So food intolerances, they start out minorly. For example, let's say like okay, I can give you a personal example for this. My dog Crypto, he is intolerant to coconut oil, but he likes he so whenever he has coconut oil as a part of his diet, that is something what I don't give to him, obviously. But whenever he gets it, he starts dripping mucus or direct oil from his stools. His body just cannot metabolize it, but he does not have any full-fledged reactions. Okay, so food intolerances can be just minor. It can be just limited to one off stomach, or even one off itching episode, or just itching until that particular ingredient or any exposure to that particular allergen goes out of the picture. But one thing is that recurrent exposures to the same intolerant thing can develop into allergies in a later phase. food intolerances and allergies tend to get evolved and are very progressive. So, for example, like let's say your dog is not allergic to chicken today. There is a high possibility in the next 2 3 years that they could be, if there is something which in their genes, or if there's something which is going on and on again, there is a possibility of them to get allergic to it over a period of time. So it keeps evolving. Okay. And now coming to the immune reactions in allergies. So a dog
Um,
immune.
just 1 second, just before you move ahead, I'd like to add here that food intolerances are seen almost immediately after the animal has eaten the food. So, say
Correct.
within 4 hours. So, let's say your dog has some kind of sensitivity to chicken, then you will see some kind of maybe diarrhea, maybe an episode of vomiting during the process when the food is getting digested. So, allergies basically manifest over a period of time. Very rarely you will see a 1 month old puppy having an allergy. But that 1 month old puppy can get an allergy at 3 years to the same thing that he's been eating at 1 month, which he's already said. The only thing that I wanted to add is that food intolerances are seen immediately after a meal.
Agree.
Like,
Yes. So, and one of the other things I'd also like to add here is, and even Dr. Chinar is here. So, whenever you're dealing with allergies, as you are confirmed about it, it is very important to work with a vet, because, and also one of the other things is like when you find a very good vet, fixate on them, don't keep changing them, because a vet will know a dog's history completely. And when you keep changing on, I can give you one personal example also with a case study actually. So there's been recurrent gastrointestinal issues in a dog. One where the first protocol to go with is antibiotics and saline as usual. And after that, the dog has been administered that over and over again by different veterinarians. The root cause is not diagnosed because the pet parent thinks that, okay, this vet solved it out for 3 days, but this came happened again. So I'll change the vet. So the client has jumped from, I think, easily 10 vets in Bangalore. So
Yeah.
you need to fixate on someone so they'll be able to understand the case. It'll definitely take time because every single dog is different. So you need to take some time out to understand that every approach will definitely work, provided you need to fixate on it properly. So this other thing is allergies and food intolerances also can be genetic or acquired. For example, if the pet, if there is anything in the genetics, like let's say a dog's mom is allergic to chicken as a main protein, that particular trait of a dog has been acquired to the puppy. So that comes as genetic. So those things cannot be resolved. Any allergies which comes in through the genetics cannot be resolved. That is something which is to be made very clear. Is because you cannot get into the system and change the genetics. That's practically impossible. And then the acquired allergies are something which any and which a dog acquires over a period of time. Like let's say, example as food allergies, that could be one of the examples, and even other things could be dust and all those things.
So, sorry, just a quick question here. So, acquired allergies can be
They can be managed out.
okay, and they can also, you can also become, your response can become better to.
Yes, by reducing, for example, one thing is that you can take off that particular exposure to that particular allergen for a period of time, like let's say 6 months, and later reintroduce it in a very small quantity. And you can see if there is any response. If that response occurs again, that's when you completely conclude that, okay, this is not happening. My dog is not taking to it. Maybe try it again after 2 years. Let's see if the okay, but always try out things in a very small quantity to determine on an allergy. So whenever I work with clients on allergy trial basis, first thing is allergies are not always allergies. It could be minor nutritional deficiencies also. So first go ahead with a complete and balanced diet, which is something we should be discussing in the next slides. So no, I've not finished one more.
Sorry.
So, and one of the very key factors to I keep in mind here is that parasites and are one of the leading causes to mimic allergies. For example, like let's say your dog is having recurring stomach issues. you have no idea that your dog has worms. So a worms will have, for example, worms will cause mucousy stools. It will cause massive itching near the butt area and near the tail if your dog is continuously chasing the tail, etc. So what do you think that there is something in the food which is causing the allergy? So please rule out parasites as a number one concern. And as a matter of fact, parasites are something which is very riskier, and with the amount of and also parasites are getting very resilient nowadays. It's not one deworming is clearing out any worms. I personally had to deworm my dog 4 times in June because of the amount of worms like stomach issues he had, which is a long story. Um, yeah. And so, but the thing is so please ensure to clear out the obvious factors before you jump into conclusions. Now we can move to the next slide. Yes. So you see two pictures over here of the ear and the skin rashes. This is this is Sagel's dog's skin and the recent ear infection. And the root cause for this was because there was renovation happening in their home. This boy went to the painters, took their cloth, played around with it, cleared out in about 2 hours. And he played with the dirty paint cloth, all those things. But yeah, this was the allergic response and he had to be on antibiotics. But yeah, coming to the symptoms of allergies in detail, is that every single dog exhibit a different kind of symptom. And I can give you one personal example over here is that my dog Crypto is completely allergic to oats. So if he has, so I actually got to know about this on his first birthday when my friend baked him a oatmeal cake. He had the cake in about he had the cake at around 5-6 p.m. We had the celebration in a park. At night's 9 p.m., he was like all bloodshot red. A white Labrador was literally like red in color. His skin had inflamed so badly. His ears was inflamed, very similar to the things which you see on the picture right now. The paws, he was continuously licking, and I had to give him a steroid and all those things to take care of that for that particular thing because he was itching so badly that he was actually going to break the skin and bleed out. So that is like a full-fledged allergy. An intolerance would just be limited to itching.
So here, yeah, that like it can become confusing this point because here the reaction also came within 4 to 5 hours. So intolerance may usually itching is also rare. You will see normally gastrointestinal symptoms only, like your stomach was not able to digest or tolerate the food. So like in allergies, you might see diarrhea, vomiting, skin, everything. But in intolerances, you will mostly see gastrointestinal signs. Very rare cases you might see something that comes up on the skin, but like chances of that happening are very less. Allergies usually manifest into skin conditions 95% of the times.
Yeah. So he did not have any gastrointestinal ones, but he had the allergy flare out. And it took me about a week to sort that out. But yeah, he was on e-collar, all those things. I did not have a choice. He was he was going bonkers.
I'm sure, yeah.
And yes, so allergies. So each dog has a different symptom of showing allergies. So as a dog, like they may itch on a different part of the body to show that particular thing. And at the last one is even gastrointestinal issues, as Dr. Chinar mentioned, like recurrent acid reflux and including colitis. Colitis is nothing but bloody poops, and even mucousy poops are also one of the factors which shows could a dog could be allergic to a potential thing. But that being said, in the earlier slide I mentioned about parasites also, so please keep an eye on that and ensure your dog is dewormed properly with a proper medical formula. Do not skip your dog's dewormings because that is utmost importance. And I'm not sure whether you guys know this, but you guys also can get worms from your dogs if they sleep with you on the same bed. Don't forget that, which is a very
But
important thing.
prevent, I mean, you can, it's just learn how to prevent worms in yourself and your dogs. So, dog sleep with you. Although it is like I've done public health and I should not be recommending that, but just prevent. That's fine.
Yeah. Deworm yourself and your
You
dog.
yourself and your dogs.
I do myself. I'm done. No, because whenever whenever I know that my dog may have potential worms, I like, you are getting dewormed, I'm getting dewormed. We are both are safe. No risk. No risk.
How many people in this group have recently, or at least say, okay, last 12 months, have dewormed themselves, have had a deworming medicine themselves?
You're not raising your
Only
hand.
the experts. No, I've not. Only the experts have done that.
Because I think we've just read too much. So I mean, it is not very easy to get worms, but like, अगर हो गया, then it is very difficult to get rid of them.
Yeah.
So
And
I
also,
didn't
I'm
suggest.
not, and also one of the other problems is that these worms are so pesky, they get into all your organs and all those things. Like,
Okay,
they
we
do
got
harm
it.
with your
We'll
intestines.
deworm ourselves. Please don't
I,
Yes,
scare
very
us
much.
more. Yes, guys.
Yes.
So one task for all of us who've joined this group and have and have our dogs. We should give a deworming medicine to them first thing tomorrow morning and buy one for ourselves as well.
Excellent.
Yes, let's continue.
Okay, so you can move to the next slide.
Sorry, very quick question. What's the best dewormer for a human being, especially a red meat eater? Not me, my husband.
Oh, yeah, I think because he eats pork. If he eats pork, then definitely phenylbendazole. But you need to ask your doctor for your dog.
Mithun, later please message me this name.
Of course.
Cool, thanks.
Hi, Mithun. I have like two questions. Should I ask now?
Yes, please. If it's
Yeah.
regarding to the same topic, you can.
Yeah, it is. So one is I wanted to know, like, I have seen this in my dog Pluto. Like, also I guess the brand of, like, for example, in terms of chewing and bones, like I have seen, he reacts differently to two different brands. Like, without taking names, I have given him maybe say a bone from one brand. He will not take it properly. He might puke the next day. But then when I changed the brand, I saw that, he's, because earlier I thought maybe he's allergic or maybe intolerant to that particular meat. So I stopped giving it. And but then when I saw that I gave him maybe the bone of that particular meat from a different brand, uh, I saw that he's not having any issues at all. So this also, is important. I mean, this also happens.
Yes, this varies from dog to dog, and as from a personal experience, I can also say that some dewormers do also have small amount of laxatives to expel the worms. So that could be one of the reactions that your dog could that Pluto could have faced.
I'm not
And
talking about dewormers.
Bharat can
I'm
add more.
talking bone, sorry. Yeah.
Mithun, what? So the question here is that the dog reacting to different same bones, but from two different brands. Is that possible?
Yes, very much likely. So you can definitely stick to the particular brand which does not cause any reaction.
Right. And another question, which I guess Mithun earlier said, when we, consult vet for food intolerance or allergies, they sometimes tend to prescribe allergy-based kibbles, right? But again, I mean, considering, how there is fear mongering in the market regarding kibbles and how we don't even know, I mean, most of the brands, we don't know what meat, because they say very generic terms are there on the ingredient list. So in that case, like, do you think we should shift to kibbles and go by the vet's advice? Just want
We
to
will be discussing about this at the last. We'll be discussing about therapeutic considerations in like allergies and food intolerances.
Sure.
So now coming back, it is very important to understand your dog, and you need to know everything about your dog. So you need to take some time off to like basically observe your dog, especially if they had to have any particular said issues. So the first thing is, when you see my dog is itching. Okay, now tell me what part of the body they're itching. How many times they're itching in a day? And how and when you mean itching, are they just itching any one part of the, like let's say they're itching only their ears? There could be something which related to the ears, or it could be a ear inflammation or ear infections. And if they're itching overall the complete body near the elbow or even their underarms, etc. So it's a totally a different thing. Each part of the body has a different kind of an itch symptoms also. And the second thing is, do they have any hives or hotspot, any redness? So you will need to look into your dog into very much detail before jumping into a conclusion that my dog could be having an allergy. And now the last question is, one of the things is also, I also mentioned this, is the dog itching until the skin breaks and bleed after having some issues, after having some particular food ingredient or being exposed to a particular allergen. This could be considered as a full-fledged allergy also, but there could be other reasons. There could be immune system related issues also to cause this. So you need to understand your dog completely before jumping into a conclusion that he could be having an allergy. And the second thing, so you feel like, let's say example, your dog is itching 10 times in a day. He's itching one time every hour continuously. Just keep a watch on them. Now, just sit back. The first thing is you need to sit and connect the dots. What has been happening in the past 3-4 days? Because this is the very critical timeline, because once something would a dog cannot be allergic to something which he ate 1 week back. So sit back and think, what did he eat? What was his last 3 meals? So it's very much important to have something written down, whatever he eats or something, which, or if you do remember it, it is well and good, but you can write this down on Google Keep or notes or something. Especially if you introduce something new, like let's say you buy some biscuit from X brand, and then you give that biscuit to him, and he starts itching after like 10-20 minutes of eating that. That biscuit may have had wheat, and your dog could be allergic to wheat. So you found your reason. Just stop that, and most of the times it resolves on its own. And the second thing, there are plants also which a lot of dogs can be allergic to, and there's a list of, like, huge list of plants, and one of them is lantana leaves, because this is something what I recall very clearly, is because one of my friends' dog ate lantana leaves, and he was admitted because lantana leaves are toxic to dogs. So that was something which I was not aware of earlier. This happened like 2-3 years back. And recently, when my dog was on a walk, he developed hives on only one side of his face. Then this is the same thing what I did as a pet parent. I sat back, think, and then there was no reason found, because no treats were given, and he was on the same diet for more than 20 days. So it was not a cause at all. And then I came to the floor cleaner, what was being used at home, ghar pe jadu pocha kya hua tha, and all those things. And then last one is what happened in the walk. And then I was just thinking that he brushed himself against a few grasses, and I later went back in a day or two, and then clicked a picture and put it on Google Lens, and found out it's apparently irritability to dogs and humans also, like exposure of that. So I'm not able to recall the name of that, but yeah, this was one of the factors. And hives went away after 2-3 days. I just cleaned it, and with hot water and stuff, it went away. And then, by any chance, did they start going on a walk on a different route? There is a high possibility they may have inhaled something, and there is a lot of other things also, like mosquito fumigation sprays. All these things could be causing an allergy to a dog. So all these are environmental factors you need to consider when a dog is having any health, any issue for that matter. And then the last one, actually, this was supposed to go up, but the order is wrong. So the floor cleaner, because your dog lies on the floor most of the time comparatively to us, like, because humans, we are walking around, we use slippers at home, but dogs do not. So they have more exposure to the floor than us. So there is a high possibility they could react to a floor cleaner also. So you need to sit back and think what could have been a potential possibility to have caused this. Any questions still here?
Right. Hey, hi guys. I don't have questions, but I can help with, you know, as in not help with, but just some information regarding food allergies. For the longest time, I never fed rice for my kids, and I have four adopted Indies. Um, when lockdown hit, because of domestic help, etc., I started to make a one pot meal. And that's when, sorry, excuse the noise. Oh my God.
Whether
That's when my youngest one would urinate every single night in her bed. And I wondered and I wondered and I wondered. And I would put, chicken and livers and rice and veggies and everything. And everyone was fine except for my youngest one. We banged our heads, me and I'm a bit of a paranoid pet person. So me and three of my vets, we banged our heads against the wall saying, what could it be? What could it be? Because she was already like 2.5 years old. And then one of the vets said, Varda, stop the rice. So it could be as simple as rice, that's bothering the dogs. So my youngest, Ziva, is allergic to rice. My 10-year-old Mithun, you're very familiar with her now, Gray, is gluten allergic. The minute she has anything wheat, strangely, except for Marie biscuits, she breaks into like a rash on her body. So, I mean, just out of experience, it can be as simple as basics.
of course.
Also, rice is it is a natural diuretic. So if you give your dogs say more rice at night, you can expect them to urinate more. It doesn't happen to every dog. It happens to a lot of dogs, and it's true for humans as well. Just adding
Oh,
a little bit.
yeah, no, that's great information. Thank you. I will pay attention to this. Yeah.
Interesting.
So when we want, so when I work on with dogs with kidney issues and all those things to make them pee out more, I give them a lot of pearl barley and white rice, which are natural diuretics. So basically, just flush out everything. So yeah,
Interesting.
So
okay,
for all of them now, what works is bhakri. So millets is obviously really positive, and obviously home cooked food is top priority. They're never given packaged food, except for my oldest one who can't get herself off RC Mini, and now I don't even want to change it because she's 15 and a half.
okay. All right. Now coming back to different type like places where a dog will itch.
There's one more question. Disha wants you to go to the previous slide, and Priyanka wants to be unmuted.
Okay, so that task is for me. Priyanka, can you try unmuting yourself? I have actually not blocked anybody from unmuting. You will be able to see a mic sign and you can try clicking on that.
Disha now says that you can move on.
Yeah. Sorry about that. You can go ahead. Thanks.
Okay, got it. Priyanka, are you able to unmute yourself?
Okay.
Okay,
All right.
we'll wait to hear back from her. I'll try and unmute her towards the end then otherwise. You can continue.
Okay. So one more thing is that every single type of an allergy. So all these things which you see right on your screen right now are different types of conditions which will cause itching to a dog at particular areas. It can be multiple other places also. The first one you see on the top left is Malaysia, which is most likely East Malaysia, which is a particular bacteria which feeds on sugar. And so for these kinds of dogs, you need to cut down any kind of sugars in their diet. Rice is something which is first thing is it's out. And the other thing, it could be even sweet potatoes and every single thing for that matter, anything which can possibly convert into glucose, like in a faster pace. So because yeast feeds on sugar, and these dogs tend to itch themselves a lot. And East Malaysia is one of the very common concerns in all retrievers. So, and the other thing is fleas. Dogs who have fleas majorly itch at the back part of their body, majorly, because that's where a lot of fleas are there. And also, one more thing to add on here is that fleas do give tapeworms to dogs. So, as dangerous ticks are there, which causes tick fever, fleas are equally dangerous because they give worms, and worms will start causing all the other issues. And then we look at atopy, which is also one of the common conditions nowadays, thanks to a lot of bad breeding practices, etc., genetically acquired. And so atopy can be multiple other things also. And there are some cases, and atopy is very easily misunderstood. And any single and majorly a lot of Shih Tzus are just being, the minute they are having some issues, they are just putting them as atopic dermatitis. But that's not always a condition. So you'll need to, like as we discussed earlier, you need to dig deeper to understand every single thing. And then we come to folliculitis, which could be ingrown fur, which could be causing like pimples, and then it could be causing an allergy and rashes, etc. And even mites, for that matter. Mites actually, it's not mentioned here, but mites make the entire body red, and all the mites is like basically highlighting the entire body in with some of the other concerns. And anyone have any questions here? Okay, yes, we can move to the next slide.
Question from Malvika. She's asked if you've had cases where dogs start to develop allergy symptoms beyond a certain quantity.
Very
So
much
to
likely.
yeah. I said that I have not seen that in my experience, but now if I were to think about it practically, sometimes if my personal, as a human being, if my exposure to dust is less, my body will not react that much. But if it goes beyond a certain percentage, yes, I will get an allergy. But for dogs, I have not seen that in my experience, but now it makes sense that they might, beyond a
They,
certain
they
point, they
might, and majorly when a dog experiences any issues with particular quantities, right? I would not consider it as a true allergy. I would consider it as an intolerance because they're able to tolerate it to that level. But beyond that, they don't tolerate it. So I personally consider it as an intolerance. But it could be, and as allergies develop, also they develop and evolve over a period of time. There is a high possibility that particular intolerance can turn into allergies at a future stage.
thresholds can reduce, can increase. uh, there is no way for us to tell you from right now only that this dog, if it eats X amount of one thing, the dog will get allergy. In future, that X amount may reduce to Y amount or may increase to Z amount. You don't know what the threshold is going to sort of work like, but you just take the journey as it comes, and then one day you will realize, अरे ये तो ज़्यादा खाने से ठीक है, or might be the opposite. So it's little difficult to say, but practically, I don't see why you would not see signs.
Yeah. So as we were discussing about that, I can tell one of the other concerns which I've had as a matter of case studies. Is that one of my very close friends, golden retriever, her dog can take in only up till 80 grams of sweet potatoes. Anything 85, here starts getting slightly red. 100 grams, here full-fledged flare. It is insane. Allergies are insane. I hate them. I hate allergies. And now coming back to allergy testings. So again, this is a very brief topic also. So first things begin with, you get your dog's first blood test done, like basic profile, and please ensure you get your dog's blood work done every single year without fail. Early detection helps with early preventative measures. And this is as a matter of fact, please get your blood works also done. That's also important. Yes, and so CBC will help you out to understand if there's any infection or anything. Look, the platelets, how the red blood cells are, white blood cells, lymphocytes, neutrophils, and every other thing. Liver function test helps us to understand how the liver being one of the detoxification organs of the system. If there's a lot of load on the liver by whatever reasons is, it could also manifest into itching and all those things. When you give a liver supplement, that's gone. The issue is gone. The itching and etc. is gone. And kidney function test is also important. And now we come to thyroid function test, which is very much overlooked, which is a very important factor. to understand skin conditions. So also one of the other things I can tell that, like as we discuss more about thyroid has a lot of implications because it is one of the main hormones of the body and has a lot of other implications. So when you do, this is very much likely applicable to beagles, as a matter of fact, over a lot of other breeds, because beagles are majorly prone to hypothyroidism on a scale comparatively to other breeds, but other breeds are also prone to it. And when you get a thyroid, so when a dog has skin issues and they are neutered and they have recurrent and they're also overweight. So these are all factors which point you to the direction that thyroid needs to be checked out. And in dogs, when you get a thyroid check done, T3 would not be much important. Free T4 is important. Total T4 is important, which is TT4, which you see on the screen, and TSH. TSH is thyroid stimulating hormone. Okay, so I can give you one example of this. One of my clients who reached out to me for basically 6 days back. His meal plan went out yesterday. So his dog, his beagle was 21 kilos. He was having skin issues along with a lot of tear stains, and he was overweight. And he had in his paws there was a lot of boils in the middle and all those things. So I went, I discussed everything, and then I was like, he checks all the parameters to tell him for a thyroid test. Get a thyroid test done. Thyroid test hua. He's on borderline hypothyroidism. Thyroid medications now started, and and B12 is also low. So medication started. He's on process of recovery. He'll be done within a month. His skin will be all shiny. So it is as simple as that, but it is very much important to understand and dig deeper. Please do not hesitate from getting your dog's blood works done. And now coming to the vitamin panel, and also to sorry for missing out, adding one more point, is when a dog has hypothyroidism, and even if it is like 1 or 2 points less than the reference ranges, please do not hesitate to start the medications after talking to your vet, because untreated hypothyroidism leads to dilated cardiomyopathy, which is weakened heart, because it tends to weaken the heart muscles along with a lot of other parameters, which could be neurological implications, because it controls the entire system. So this is one of the other factors. And now coming to the vitamin panels, vitamin B12 is one of the leading issues, like fix B12 and vitamin panels, and basically ensure to your dog is having a very good diet, and also these parameters are in good reference ranges. Your dog will be fine. And low B12 is linked to causing thyroid functions and dysfunctions. And even when a dog has low B12 issues, the complete nutrients are not being absorbed, and which will later lead to thyroid dysfunction and also gastrointestinal conditions and even neurological conditions. So this is something, and also as usual, like skin conditions, which we have to be discussing about. And then vitamin D3. Vitamin D3 in dogs cannot be absorbed from the sunlight like humans can. Dogs do not have that particular capability, and it has to be supplied through the diet in all ways. So dogs cannot absorb vitamin D through the sunlight. So if your dog is laying around in the sun, please just think that he's just playing there and then he's getting the warmth, but he's not getting any vitamin D3 from the sun. And then skin scrape test. Skin scrape test and immunoglobulin test and allergy test. I'll just give you a quick brief, and Dr. Chinar can explain more about it because she personally has hands-on experience with this. So skin scrape test is something which you need to get it done if your dog has a lot of fungal and bacterial infections, and they're not just going with a lot of things. It could be mites, it could be any parasites which could be on the skin, which could be causing the issues. And then immunoglobulin is a particular parameter which will help to understand the allergy, how severe the allergy is and the allergen responses to the dog. And then an allergy test to determine how allergic, and it's a food allergy and an environmental allergy test, and it's ridiculously expensive, by the way. It starts like 25K. Yeah. So, but yeah, Dr. Chinar, you can explain further.
Sorry, Dr. Chinar, just before you jump in. So I'm just, just for my own clarification and just for the group as well. So what I hear from this is that basic understand, like if the dog is showing some symptoms and signs of allergies, there's a basic blood work that needs to be done, yes, including the thyroid, the vitamin, and the vitamin test. So the first three need to be done to rule out any kind of medical issue before doing a deep dive into allergies or intolerances.
That's right.
Is my understanding correct?
So my approach here would be slightly different when I come across a skin case. First, though, not all skin cases are due to food allergies. If a dog comes to me saying, hey, my if the pet parent is telling me, hey, he's itching too much, there's a lot of hair loss, my first line would be, okay, let me do a blood test, because the blood test is going to tell me whether the WBC level is elevated or not. WBC level, it basically shows me the level of bacterial infection. Now, this level can be elevated. This can be the primary cause of the skin issue, or it can be the secondary cause. When I say secondary cause, it could mean कि food allergy है, उसके वजह से skin पे rashes आए, dog ने खुजली करी, bacteria infection हुआ. So in that case, my bacterial infection becomes secondary. But if the skin condition is happening because of the bacteria and there is no primary cause, like bacteria आया skin पे, उसके वजह से infection हुआ, there my bacterial infection becomes the primary A. So with my basic blood test, I will know whether the WBC is going to be high or not. With the basic blood test, I will do a skin scraping test because it will help me figure out whether something else is accompanying the bacterial infection, which will help me to reach another step, that is to figure out whether this is secondary or primary. So with my skin scrape, I can find out things like, oh, are there mites? Are there any external parasites on the body? Is there any fungal infection on the body? So now this I'll find out via a skin scrape. So the skin scrape will tell me whether my bacterial infection is primary or secondary. Another thing the blood test will also tell me is the number of platelets. So when the platelets are low, I will check my dog for tick fever. In tick fever also, I will see a lot of these skin signs. Like tick fever is not just fever. You can see all of these skin signs. So ideally, I would go with this. Then my thyroid function test will come after I assess. I'll ask them a few questions. So your vet will ask you questions like, okay, has your dog started eating more in the last few days and the weight is not increasing? Or has your dog's appetite reduced and the weight is still increasing? That along with activity. Thyroid issues also cause a lot of reduction in activities, because if the body is not producing enough thyroid, your animal is going to be tired all the time. And your tail usually gets a rat-tailed appearance. May not happen to every dog, happens to a lot of dogs once the issue progresses, and your hair starts becoming brittle. So I will test thyroid if I see a lot of these other signs as well. Along with this will come to me from questioning. Okay, if मैंने ये question किया, these things are happening, I think I need to check for thyroid. If the questions do not lead towards thyroid, I may leave thyroid for थोड़े time बाद check करते हैं if other things don't work out. Now then you derive like a plan of treatment from this, and then you go and follow this treatment for about a week, 10 days time to see whether symptoms are relieving or not relieving. If they are not relieving, you move forward. Then you move into food, and then food also, it really depends on what kind of clients you are getting. These tests are very expensive, so there are a lot of people who don't prefer to go for them. In that case, they'll tell us things like, okay, is there an alternative way where we do an elimination trial? Okay, 1 week you keep your dog only on one thing and see if your dog is showing any improvement or not showing any improvement. Then in week 2, again you keep a dog on something else and see whether your dog is showing an improvement, not showing an improvement. Like this, you check all the ingredients in the diet that you're feeding your dogs, and this is easier done when a dog is on home cooked food. If your dog is on kibble, then doing this kind of a testing is very difficult. Then you do this thing for 8 to 12 weeks, and then you start reintroducing the food that you stopped to figure out whether the signs are coming back or not coming back. So this is called a dietary re-challenge. And then here comes the allergy test, which I personally feel that we should do earlier when we're suspecting an allergy than to wait for later. But the money does come into factor here. Now, IgE test is a kind of an allergy test. So there are two types of allergy. There are two types of allergy tests in terms of IgE. एक में measure होता है कि IgE बढ़ रहा है या नहीं बढ़ रहा है. So if your IgE is high, you know that the dog is facing an allergy. दूसरा type का IgE होता है where they see कि क्या चीज देते हैं जिसके वजह से IgE बढ़ रहा है. So is the IgE increasing because I've put chicken? So that test is very expensive. So they usually have a panel, and this is very commonly done in dogs who are on home cooked food, because now my WhatsApp memory is full, but I've stored that panel for you all over here. Because that is a pre-decided panel where they have everything, including food that can go to dogs that humans usually eat at home, to test for allergy. So that's the one that's more expensive. Now, this might sound like information overdose to you, but what this is what ideally vets follow when they're trying to figure out. Figuring out skin allergies is a very long and a very tedious process, and it sometimes can take months. So we sort of expect and we do a lot of testing also. Okay, पहले ये check करते हैं, फिर इसके बाद ये ऐसा आया तो इसको ऐसे deal करते हैं. So thyroid for us comes a little later into the stage, where after we are done checking the other things, like if there are changes in appetite, changes in activity. Vitamin panel is also done very rarely. But I think we should do it more often. If you are saying that this can lead to a lot of allergies which manifest in skin, vitamin panels are checked less frequently in animals compared to humans. So yes, I would suggest that if you can do it, you should do it.
I just had one question. You talked something about the tail for the thyroid test. What was that?
No, the rat-tailed appearance. If a dog has hypothyroidism, the dog starts losing hair on the tail. So it starts looking like a rat's tail.
Oh,
so
without the hair.
Yeah.
I
तो
missed that.
कॉलेज में ऐसे पढ़ाते थे कि thyroid is equal to rat-tailed appearance. Of course, there are a lot of other signs and symptoms. There's also something called as a thyroid bump. But this bump you will see in dogs who have severe thyroid. Like I say, when the levels are slightly low, you might not see this bump. And sometimes this bump can be fat bump also. Like my previous dog, Chuchu, I have tested him for thyroid at least 5 times in his life because he had that bump, and I'm like, "Ye to thyroid bump hai. Why is it not showing up?" So on the back, I think let me show you if I can. Are you guys able to see my dog?
Yes.
Yeah. This is her bump. This is her tail. This is her bump. So here fat starts depositing, and this is okay. She is not comfortable, but yeah. You get the point, right?
Yes.
So that's where you see the thyroid bump, basically.
Got it. Okay.
Shilpa has a question here.
Yeah, Shilpa, go ahead.
No, it was just by mistake. I was trying to enlarge the, the screen.
Okay.
That's right. Okay. So
Megha
this
has
is
a question. Sorry, I think Megha also raised her hand. Megha, that was by mistake. Okay, so I think we can continue then. I think now we understand, your side of the story as to why some of these things is not. I think as pet parents, we also need to be patient at times. Like Mithun said, at the beginning, just stick with one vet. The vet is going to try a few things. You need to give the vet the time to go through this entire cycle of testing and all. I think, sometimes as pet parents, we tend to get a bit more anxious and restless. And
of course, no, I can definitely understand. Finding a good vet and would be a very key factors, and sticking. And once you know that this person is really good, stick to him. It's very important.
Yeah.
Okay. So now, okay, fine. Allergies are done. My dog has allergies. Now what? Okay. So till now we were just discussing about how to go to allergies. Now we are discussing about treatment protocols and how to sort this stupid thing out, which troubles us so much. Anyway, so firstly, there are two different ways of this. One is food therapy, and as we were discussing earlier, an elimination diet is one where we give, and I highly prefer a elimination diet when it's done on home food to begin with, and where you have very minimal ingredients, basically like 1-2 ingredients. Okay, so it could be one meat protein, because protein is definitely important, and you can look at with one vegetable. So this is how you start it off, and eventually you can. And elimination diet happens over a period of 12 weeks at the most basic. The basic elimination diet takes 12 weeks, where we introduce 3-4 ingredients. If you're having a lot of other ingredients, like let's say my dog's diet right now, he eats 12 ingredients of different things per day. So this touch wood, yeah, I'm not going to tell it also. Anyway, I don't want my dog to allergic. I'm too superstitious in that way. Yeah. So it'll take a very long time to understand through an elimination diet, but this is one of the key factors, and it will help you to understand your dog's food allergies very beautifully. But this will not make much of a difference if your dog has an environmental allergy, because environment has to be managed, which we will be discussing in further. So elimination diet ka ye hua. Now coming to novel ingredient diet. Novel ingredients are nothing but new ingredients in a dog's diet. Like let's say your dog is now allergic to chicken. Example. Remove chicken from the diet and move to mutton or any other meat for a good period of time. And please ensure you're feeding a complete and balanced diet, because nutritional deficiencies also mimic as allergies. So as we were discussing, like, and the most earliest thing, Mansi's dog had started having nutritional deficiencies, and she thought it was allergies, and it was done with supplements, which majorly balanced out the diet, and it was sorted out. So that is one of the other things. So CNB over in the screen notes for complete and balanced. So complete and balanced diet is a very important factor. Novel ingredient diet, you introduce new ingredients which your dog has never had in its life before, and that's when you understand allergies. So for as a personal opinion, I prefer not introducing my dog to a lot of ingredients in the beginning itself, because like let's say my dog is having 2-3 proteins as of now. Okay, God forbid, any point of time he develops an allergy to a particular protein, I will need other options to keep to use later on. Like let's say I feed every single thing which is available in the market today. What am I going to do when there is a need arises for it? That's why if your dog is doing very well on chicken, mutton, fish, etc., please stick to that, and you can keep other ingredients to use at a later stage. Do not experiment with a lot of other ingredients in the way of adding in variety to a dog's diet, which is also one of the very important factors, by the way. But do not keep, like let's say in my case, I have kept quail, turkey aside on, like and even rabbit to keep aside for my dog forever, in case ever he develops an allergy, to use as a novel protein. And I cannot feed beef and pork, so that's out of the question. But anyway, घर पे नहीं बोलूंगा बस.
Yeah.
And now coming to hypoallergenic diet, as Debina asked in the earlier slide when we were discussing about things, hypoallergenic diet can be either fresh or kibbles. Fresh hypoallergenic diet can be very similar to novel protein diet, novel ingredient diet, but hypoallergenic diet in kibble is a very different topic. Even you see, like let's say hypoallergenic kibbles, I'm just going to give you in a short brief on how hypoallergenic kibbles are. So what happens over here is, like example, in the ingredient list, chicken is written, hydrolyzed chicken is written. So what you read, you see the ingredients, you see hydrolyzed chicken written, and later you'll be like, no, my dog is allergic to chicken, so this kibble is out. But no, in hydrolyzed kibble, your dog, so basically a dog is allergic to the protein structure, is not allergic to the protein directly. For example, like let's say when you cook chicken at home and you feed a dog, and your dog is is having an allergy, but later you feed kibble as a form of chicken through kibble, but your dog is not showing any reactions to this. Why? Because kibbles, when they are being manufactured, the protein is broken down and formulated in a different way, and in a hydrolyzed form, which the body does not recognize it as an allergy, and which will not trigger an immune system response. This is in simple words on how hydrolyzed diets work.
Basically, they break down the protein to such a small constituent. Like protein is made up of amino acids, right? So
Yeah.
they break it down to such a size that when it goes inside the animal's body, the body doesn't recognize it. कि ये तो कुछ छोटा सा है. It's so small that there is no way for body to recognize it as a foreign particle. That is hydrolyzed here. And then there is novel food also in kibble form and in fresh food form, which is pretty the same thing.
Yes. There's a lot of other formulations of novel kibbles like duck quinoa formulation, turkey, salmon, and all these things. So and especially so hypoallergenic diet, a dog will come to it at a stage when there is a lot of things which is not working. But many times they do jump into it as per recommendations, and they will be on it. And it will totally depends on dog to dog and how well they are accepting that particular. Okay. And now coming to the medications. So for example, like let's say the dog is allergic to a particular thing and it's not being solved by med. And there are situations where you have to cut down on certain things and you have to give the body some things which to prevent that skin from breaking off because they're itching so badly and they're basically becoming red, all these things. And a few of them are antihistamines, corticosteroids, and immunomodulatory drugs. So Dr. Chinar will be able to explain this better more than me.
So like he said, right? Now your dog has an allergic reaction. Before you figure out what the allergic reaction is to, you need to resolve that reaction that has already happened, right? You can't leave a dog itching, or you can't leave a dog with skin condition. That allergy is going to turn into secondary infections because of itching. So what do we do? So think very simply, like what do you do when you get an allergy? Your doctor will be like cetirizine le lo, Avil le lo, right? So that's an antihistamine. So we do the same thing for animals. We tell them कि you give your dog cetirizine or Avil, and we start off with that. But now we'd already diagnosed कि हमने blood test भी करा था, and we check कि WBC normal है नहीं है, normal क्या है. So if the WBC is high, then it means that the dog has secondary infections. So we also put the dogs on what do you say, on antibiotics if need be. If the WBCs are not very high, we try to resolve the issue without antibiotics, because we also don't want them to develop any kind of resistance. Then steroids are basically something that I personally don't like to use, because what happens with steroids is that your reaction, your problem will resolve, and it will resolve very quickly. But the minute you stop steroids, the problem will come back twofold. So the case where you should use steroids is when you know for sure that the dog is atopic. So atopic diagnosis usually comes very later on, when you are done with all of this and nothing works out. And then if your dog, there are some other medicines called as cyclosporin and apoquel. When you reach a point where you're like, okay, I need to keep this dog on cyclosporin and apoquel, that is when you also need to keep the dog on steroids, because those are the only medications which are going to help you control the infection. But this point comes on very, very later. For me, if it is not atopy, I will just avoid using steroids at all costs. Then I'll try using lotions which are, sort of soothing to the skin, like dermichlore, even things like aloe vera gel work. And then immunomodulatory drugs. Again, immunomodulatory drugs come into picture when you have determined that it is atopy. Atopy is basically happens to dogs. Usually it is genetic, where a dog has so many allergies, or they come from the environment, they can come from food. Basically you can't figure out. कुछ भी नया आता है, कुछ भी होता है, एनवायरनमेंट से एलर्जी हो जाता है. एंड देन एटोपी हैज सीजन्स ऑफ फ्लेयरिंग अप. जैसे फॉल सीजन है या स्प्रिंग सीजन है, वेयर देयर इज टू मच पोलन अराउंड, टू मच डस्ट अराउंड, योर एटोपी will sort of will sort of it's a
Flare up.
trigger. So it will what aggravate. So atopy में क्या होता है, that these medications, they are increased and reduced, sometimes stopped, then started again, and these dogs have to be on these medications for their life. But food allergies which are not atopy, They can be resolved without steroids. You just need to figure out what works for your dogs. And then apart from these oral medications, your vet might recommend regular medicated baths. They might give you some lotions to apply. And and once the problem resolves, they will also tell you to reduce the frequency of bathing. So till the problem is there, till the skin becomes better, you might have to give them medications. Once the skin is better, you can just focus on nutrition and ensure that you give your dogs things that they are not allergic to. I hope this was clear.
Yes,
It's
it was.
it's very difficult to say in a video chat if you're able to understand or not. So if you have any doubts, just feel free to ask. You're on mute, Mansi.
I'm on mute. No, I was saying this is very helpful. It's good to know. Like, yeah, I think very well explained.
So now coming back to dietary factors, they influence a lot of things. And also, I'd like to add on one more thing here. So there's been a client who's been working with me for the past 1 year, and she came to me telling that her Shih Tzu has atopic dermatitis and with recurrent flare-outs and all those things. And the first thing with me as a person directly is that I don't believe atopic dermatitis so easily. The first thing is I focus on a complete and balanced diet, and when a complete and balanced diet doesn't work properly, that's when we dig deeper and all these things. Because atopic dermatitis are not always atopic dermatitis unless they have it for forever. You can never imagine. Okay, and the first thing is feed a complete and balanced diet. And that I was talking to her yesterday. I had a call with her yesterday, and she told me, Madan, he's not been having any flare outs whenever he's stopping the supplements and all those things. Like, he doesn't have an atopic dermatitis. I'll just let you know. I'll the updated supplement chart. So that's it. And she was so shocked to hear that my dog doesn't have atopic dermatitis. Like, and then she had told me, why did you not tell this to me earlier? See, I gave her a very practical solution. Like, I knew this for a very long time because after the first 1 month of following the diet plan with all the supplements, everything resolved. Even with whenever he's being the Shih Tzu, he goes to the bath to the groomer every 15 days, and the groomer is telling there is no rashes, everything is doing well properly, and all those things. And then I told, see, you come in through a reference who already confirmed atopic dermatitis, and everywhere you've read that atopic dermatitis, you have believed that your dog has atopic dermatitis. Just imagine me as a total stranger, you reached out to me and I tell, no, your dog doesn't have atopic dermatitis straight up. You will definitely think I'm a mad person because I don't understand the condition. So the first thing is, let me solve everything. Then I will tell you that your dog did not have anything. So now you can clear this out of your head. So now coming to, and she was really happy that my dog doesn't have any, moderate condition. She was really happy with that. And she was like, I was so scared with like putting my dog on lifelong steroids and medications with the way he had flared out. So he had become like all red, etc. So now coming to the dietary factors. Number one, as we are discussing about this, dehydrated treats and chews, whenever you feed these, they are basically drying. They are dried meat, so they cause dehydration, especially if your dog doesn't have a good amount of water intake on a regular basis. They just cause dry skin and coat, and eventually they cause a little bit of very mild redness. Okay, they don't cause much issues also. So whether that mild redness can be people do consider, basically misunderstand as an allergy also. Like, he's having mild address, there is an allergy flare out. The second thing, please ensure your dog is sufficiently hydrated on a regular basis. Like, add a lot of water into their food. If they don't eat, or if they don't eat their food with a good amount of water, please encourage them through buttermilk, bone broth, all these things on a regular basis. And then the third thing, are you feeding a complete and balanced diet? If you're feeding a kibble-based diet, yes, the diet is complete and balanced because the kibble is fully well formulated. And then if you're feeding a fresh food diet, you need to ensure that your dog is eating a fully balanced diet, every single mineral to mineral. So you can get help of a nutritionist, either me or anyone else who you find is good. And so that is one of the things. And then gut health. Gut health, like 90% of any immunity relies on gut health. So if your gut health is good, it's majorly, everything is majorly good. So you need to see if your dog is having a lot of skin issues and gut issues. Fix the gut, skin will automatically heal itself. Lots of probiotics are supposed to be given. Prebiotics have to be given. Do not fear of giving good amount of pro and probiotics. And when we are talking about pre and probiotics also, which we will be discussing in a few later webinars, is that we give that for a good amount of time, so the bacteria, good bacteria, is completely repopulated in the system. So you don't give prebiotic only for 2-3 days and then expect that everything will be resolved. It does not work that way. It will take a time to repopulate the microbiome and basically create a good microbiome for your dog. And then nutritional considerations in the diet. When we are discussing about allergies in dogs, the first thing is, as I told earlier, a complete and balanced diet is number one. The major nutrient concentrations when we're talking about allergies is proteins and lots of good fats. Fats, do not get scared of it, because fats are really important. Linoleic acid and omega-3, which is EPA and DHA, is very much important in helping the skin stay fluffy, shiny, all these things. And then we look at the good amount of vitamin E in the diet, which is an antioxidant also, which keeps the shiny coat. And then vitamin A, which is in the form of either, so in vitamin A, there are two forms. One is retinol, which is derived from animal parts, which is liver, and beta carotene. Dogs do not have the optimal capacity to convert beta carotene into retinol, which is a usable form of vitamin A. So if you do feed a lot of carrots and sweet potatoes as a form of vitamin A, and please don't expect that to be converted very efficiently, because you need to feed liver. So that is one of the things. And then we definitely look into other concerns, is micro minerals, more than macro minerals, which is calcium, phosphorus, potassium, sodium, and chloride. All these things, micro minerals play a very big difference in skin health and coat health and the overall immune system, for that matter. And the prime ones is iron, copper, and zinc, even iodine for that matter. And people who know me as a person, they know my zinc is my most favorite mineral. More involved in more than 300 enzymatic functions. It controls every single thing in the body, starts from immunity. And personally, I can tell you, I take my own dog's zinc supplement, which I keep in the cupboard. Whenever someone sneezes on me, I'll be like, I don't want to catch a cold. I don't go for any medications. Zinc le lo, vitamin E le lo, fish oil le lo, immunity sorted. So it works in this way, and it's a very different thing when it comes to that particular matter. So zinc is one of the very much important factors, and majorly whenever I work with Indian clientele, zinc is the when I put their dog's existing diet on a Excel sheet and look at what is the zinc intake, they are not even meeting 20% of their required allowance, which is alarming. And this, over a period of time, low nutritional deficiencies will increase over a period of time. So basically replenish the dog's mineral reserves in the system, and your issues will automatically heal themselves. Okay, so that's why we focus on a complete and balanced diet. Or when there is a lot of things on the internet, like there is ratio diet, there's all these things, and like don't do anything, just feed a fixed recipe which is complete and balanced, you're done. And my dog eat the same food for 20 days. I prepare my dog's food I feed a raw diet. If people do not know about it, I feed a raw diet personally. I prepare 20 days worth of food. Everything goes into the freezer. It gets frozen for a good 15 days before it gets fed to my dog, because India being a tropical country, pathogens are a very risk, and मुझे अपने dogs को worms नहीं देना है. And when it comes to cooked diets, these are also the factors. Like all these nutrients should be taken care of. Okay, and now we come to environmental management. Is that if you do
There
figure
is
out,
one question for you.
Yeah.
Would you mind talking about IBD, SIBO? What is SIBO and associated secondary symptoms? And
small intestinal bacterial overgrowth.
okay.
Okay, yeah. Okay, so IBD and SIBO are also very they tend to get triggered out with allergies, very much likely. And what happens with small IBD is, and small intestinal bacterial growth are very strong ones, for to be very honest. They are like stage 2, stage 3 of gastrointestinal conditions. and it's very critical. It has to be managed out. The major nutrient considerations for IBD is, and even SIBO for that matter, is a very low fat and a minimal ingredient diet, because IBD tends to get triggered with fats. The gut lining gets triggered out, and you need to ensure to give a good amount of antioxidants in a dog's diet, etc. And majorly that's about it. And yes, pre and probiotics at most important. And there's a different strain of pre and probiotics which has to be taken care of. And there are a lot of pre and probiotics also which can cause bacterial overgrowth. And one of them is S. boulardii, and it's a very big thing for that matter. And coming back to environmental management on this particular thing, is that when you feel that when you spray some perfumes in your homes or air fresheners, etc., for that matter, you will need to see if your dog is itching. Basically, do not use all these ingredients in your dog's vicinity, especially essential oils, which can also be toxic, again, because of the smell factor. And two very important tips to manage out the environment is that cleaning your dog's head to toe after their walks will basically wipe them off any dust or anything, which is going to make them safer. Clean your dog's paws. That's totally non-negotiable after walks, because it's pretty dirty outside. And then when you do feel that your dog could be allergic to a lot of things, especially the environment like grass, trees, etc., and even pollen, as Dr. Chinar mentioned earlier, you and seasonal allergies also, like from during fall and summer season, etc., whether it's pretty dry outside and your dog goes there and they tend to start developing any issues, prevent those exposures. Just walk in a plain area where there's not of these things around. So these are some key factors which will help out with the environmental thing. And yes, if there's any other questions, you can let me know. Hello.
Yes, we can hear you. Are there
Just trying to talk on mute. Yeah, super awesome. I think that was great. So yeah, we're open for questions now. And anybody has any questions, please feel free to type in.
Or you can.
Amazing session. And I think, yeah, Zinc worked. I have to add on to that. Zinc worked so well for you. He has, I think, yeah, we've been able to manage and balance his diet and his nutrient intake. And I think that worked wonders for him. So I can vouch for it, that one needs to balance the diet. Yeah. Okay. So, any questions, anybody in?
So I have just one small question. We've addressed, intolerances and allergies to various food products and so on and so forth. What about the vaccinations? Because my Buffy, who's a sturdy, hearty indie, about 34, 35 kilos of age, that last 2 years that I've vaccinated him, he's broken into hives, and then the vet has told me to give him Allegra. So the first 6 years of his life, vaccinations were smooth. When he was 7 and 8, he broke into hives for a little while immediately after his vaccinations. Allegra sorted it out, of course. Allegra 120 mg, one tablet for 3 days, sorted it out. But why did that happen? I mean, suddenly, like regular vaccinations, 9-in-1, anti-rabies, etc. Why did that happen?
Maybe he developed an allergy. So vaccine allergies are not very common. Vaccine reactions are common, where post the vaccination, you might see some kind of diarrhea or some kind of fever in your dog. Vaccine allergy is the kind that you described, where the dog breaks into hives. They're very uncommon. Now, does this happen with both 9-in-1 and rabies, or just with one of them?
So I don't know which one of the two, because both are given at the same time. I have 4 dogs, and Buffy is the toughest to vaccinate. So literally, we trap him in a window. He hates the vet. I don't want to muzzle him. So I trap him in a window, or make a little gap where the syringe goes into his posterior, And
Yeah.
that's that.
So, I mean, if you really want to figure out why this is happening, you need to first start giving the
Space out
vaccine.
the both.
Give them on separate times so that you know which
Oh,
vaccine the reaction is coming from. It is also, has he had any other injections except his vaccines in the last 2 years?
no.
Yeah, so what if he is allergic to the needle? We don't know that. So
Oh, damn.
this is
So,
like a process of figuring out. The easier way to go through this is to just give him an Allegra when he has a vaccine, but you would want to know if he's reacting similarly to other injections as well, so that you're prepared for the future. You said he's 6 years, so I think by the time he's 9,
eight.
10,
He's 8 now.
he's 8 now, so he's
Yeah.
already
And the
on the
first
older side.
6 years, he had no reactions. And because he hates the vet, unfortunately, the vet comes home because it's really tough to take 4, 5 dogs to the vet.
Yeah,
She sweetly comes home. Of course, I don't vaccinate the 10 plus dogs anymore, but
yeah.
the two younger ones, the youngest one who's 6 is fine. But the last 2 years, he like broke into these little hives when he was vaccinated. Of course, I immediately gave him an Allegra and it settled down. But I was extremely surprised because I mean he's my sturdy boy.
No,
You
no,
know,
you can figure it out. Try giving the vaccines at separate times. Also, there's a vaccine called rabies lepto. It's called RL.
that's the one we give. Yeah.
That's the one you give. So is that so are you giving 9-in-1 or are you giving rabies lepto? Because in the years when we give rabies lepto, we don't give 9-in-1.
Oh, that I did not know. The vet is giving both.
The vet must be giving rabies and 9-in-1. For dogs who are plus 7 years, sometimes they don't need the 9-in-1 because their immunity is strong enough. So what the
Mithun,
protocol
I told you, na, 10 plus, they don't need vaccines.
no,
Yeah.
they need rabies lepto. They need they
Sorry.
so,
So
so
my
there is
oldest is 15 and a half, and I have not vaccinated her for the
yes, that
past,
one can go without vaccines because here
I
the
have not vaccinated her for the past 5 years. And touch wood, so far so good.
touch wood, yes.
Good. That's good.
Yeah,
Deworming is all I do, but
yeah.
yeah. And
No,
also
no,
they're indoor dogs, and I'm very particular about not touching their noses either, or not licking rubbish on the walk and things like that. So
no, so makes sense, right? So we try to reduce the amount of vaccines we give as and when the dogs get older. So in the years when you give rabies lepto vaccine, that time we do not give the 9-in-1 vaccine. And in the
okay,
years when we give 9-in-1 plus rabies, then there is no RL given. So
okay,
you can try getting the vaccine separately, or you can try figuring out which is the injection that is causing a reaction because you want to be prepared for future.
okay,
Might need more medical care in the future. So it's better if we have figured it out now than later.
okay. Perfect. Thanks, Doc. One more question. My gray, Mithun is extremely familiar. I'm sorry, Mithun, you're smiling like because you know everything, but I have to ask this. When my gray was neutered, obviously she was anesthetized, right? And when she was anesthetized, mm, the vet, he's an extremely senior vet in Pune. I've known him for over 25 years now. He very categorically turned around and said to me, so her heart rate shot through the roof to the extent that he had called me into the OT to talk her down. She was under, but like he told me, hold her paw, talk to her. And I actually saw her heart rate drop like drastically. He very categorically turned around and said to me, avoid anesthesia in the future. And now Mithun knows her history. She has multiple benign tumors. She has a liver condition which Mithun's been treating since Feb. uh, do are dogs intolerant or allergic, whichever way you want to put it,
Can
to
react to
anesthesia?
anesthesia. They can react to anesthesia. In this case, you want to ideally figure out which anesthetic drugs were used when he had gotten neutered. So then the next time you need to get a surgery, if it is absolutely necessary, you steer away from those drugs and use different set of anesthetic drugs.
But what if she reacts to them and she's already 10
Now
And
there's something called as gas. Was your dog
gas,
operated on
no,
gas
at that time we didn't use gas. This was 10, like 9 years ago. At that time they didn't use gas, but now he uses gas. Jason, yaar. And now he uses gas, but I just don't want to take that chance.
गैस में क्या होता है that you can immediately take the source away, right? जैसे in your IV anesthesia, the medicine goes into the blood and then it metabolizes. But with
Right.
gas, you can just, if you think the dog is reacting, you just remove the source of gas and the dog will come out. So you could, I mean, it is in the end, it is your call what you need to do. But if you need to do a surgery, there are more alternatives now. So you don't have to be very scared about it. Just be careful about which drugs are being used and tell your vet about this incident.
He remembers. He remembers it like the back of his hand.
Which vet
He
is this?
doesn't seem like it. Dr. Sagar Bhongle.
Okay, okay.
I am probably his most paranoid uh, pet patient. He knows me. If he doesn't answer my phone calls, he gets it from me and he knows it. I have too many cases on hand. I have 4 pets. I can't help myself. He has to answer. Otherwise, he's had it. He's like a brother now. It's the association is that long. So
Great. That's good to know that, I mean, I think a lot of us here are like paranoid pet parents.
oh no. I think of course everybody cares just as much, and it's very difficult being practical when you're put in a situation. Or despite the fact that you know what medication needs to be administered, often as a parent, one tends to not be able to recollect or not be able to register. Like, for example, tick fever. I know exactly what needs to be done because I have handled so many streety cases. I'm an animal welfare worker, so I've handled so many cases to the extent that my husband got tick fever and I was able to tell him, "Ki boss, please start to take, Live 52 along with." Yeah, see, he's cribbing 5 days. That why didn't you tell me? And then he had to go spend a whole bunch of dollars on getting a blood test. But I know exactly what needs to be done. But it doesn't strike you when it's your own child. So yeah, yeah. To
Completely.
date, Jason curses me for making him spend $1,000 in Kenya to get blood test reports, only for me to be able to tell him exactly what medication he needs. 3 weeks of doxy along with Live 52, and you're set. But it didn't come to mind.
I guess happens.
Yeah.
So anybody else has any questions or thoughts here, or any questions for Dr. Shinar or Mithun? Okay, so we've shared a wonderful code for all of you. It's a heads up for tail code that you can use on all their products. It's in the chat. Please copy the link and the code. You can use it for all Huffed products only. And okay, Malvika has one question. Mithun, if you could take that. Do
Affect you,
we have some more questions here.
Intolerances should not ideally affect the eosinophil counts, but I would not be surprised अगर थोड़ा सा high होगा तो, but not as high as allergy for sure.
And Shella also has a question. You can unmute yourself and please go ahead and ask.
Yes, hi Mithun, hi everyone, hi Mansi, hi Dr. Janar. Hope you all are doing well, and it was a very nice session. Really nice understanding, how we can take care of our babies in a very much better way than we normally do. Just a quick question. So, Mithun, I'm sure you remember, I had a Shih Tzu who was like 1 year, 7 months old, and I lost him because of the medication and because of basically anesthesia. When we were talking about anesthesia a few minutes back, he got an overdose of anesthesia and I lost him in the hospital itself. and there was nothing much I could do. So I have, cutting short, I have another Shih Tzu with me. He's 7 months old, and he will be 8 months next month on the 7th. And I'm planning to get him neutered. A little hesitant, with the anesthesia, taking a different route altogether when I actually just took him for a CT scan, because his my previous babies, the legs were paralyzed all of a sudden, and I was told by his vet in Noida to get his CT scan done. Just took him for a CT scan, and I just lost him with an anesthesia overdose. So a little skeptical. Should I get him neutered right now? Is he too young, or should I wait for another few months?
Want me to answer or you want to answer?
Dr. Tina, you should go for this.
Uh, he's- so see, now with dogs, the ones that are small breed dogs, they usually reach their full growth by the time they are 6, 7 months old. With large breed dogs, they can reach their full growth stage by the time they are 2 years old, depending on the breed. So they need the testosterone for the growth plates to develop. So it's not too early to neuter your Shih Tzu, but it's also not too late. If you're very paranoid right now, you can neuter it after 2 months. It's not going to make any difference. Just make sure that you verify the place from where you are getting his neutering done. Preferably select a place that has gas anesthesia, and ask lots of questions to the vet, and tell them that you've had this in the past, which is why you're a little paranoid. So the vet will also keep in mind to give you more regular updates about what's happening in the surgery. If he's neutering, surgeries do not take more than 30 minutes, and the process of the dog getting into anesthesia, getting onto the system and the table, that whole process takes about an hour. So you're talking about a process of about an hour and a half, where your dog would be under anesthesia for about 1 hour. So if you have a place where gas anesthesia is available, choose that place, research the place well, and you don't need to do it right away. You can wait for 1 year, you can wait till 2 years. So there is no, just don't wait till the time he's like 5 years old, when the anesthesia actually becomes a risk, because with the age your body's tolerance to anesthesia reduces. So make sure that you do it while he's young instead of doing it later in his life, but you have time.
Okay, thank you, doctor. One more thing, that this doctor who actually I am now going to is the same doctor from where I got my first baby from, and the second one is also from him. So it's actually his brother who I
Yeah.
got. And I say in Noida, the doctor, the vet, the breeder from where I got him is in Delhi.
Okay.
It was very close for me to take him to a vet in Noida, which I know that is my fault, because I should not have changed the vet,
No,
who
no.
actually took me to a different, direction altogether.
No. See, accidents are not entirely unheard of, and accidents can happen anywhere. You could take your dog to the best facility possible, best doctor possible, but सबके यहाँ पे accidents होते हैं. Sometimes it is not even the vet's fault. Like, anesthesia overdose kaise hua, you don't know what exactly happened in the theater, right? Sometimes what happens is that if the dogs are aggressive or dogs are hyperactive, the regular amount of anesthesia that would usually calm a normal dog down might not have calmed your dog down. So in that
So I
case,
have a Shih Tzu. It was a Shih Tzu, a
yeah.
small baby.
So, I mean, I totally understand that you have to be very careful, you have to research, but don't blame yourself for this. Like, there was no way you could have known where to go, where not to go. So, it's just, it happens.
Yes, thank you, doctor. One last question. Very sorry, simple question, not anything related to whatever has been discussed today. How dangerous is passive smoking for our baby?
Very dangerous.
Dangerous.
So, yeah, I mean, avoid as much as you can. I know there will be circumstances where you won't be able to avoid, but avoid as much as you can. It can eventually cause lymphoma in dogs, which is a type of cancer, but you'll never be able to figure out why it happened, right? Anyway, with cancer, we don't know sometimes why cancer happens. So it's just one of those things. जितना नहीं करोगे उतना अच्छा है.
Okay, perfect. Got it. Thank you.
Yeah.
Priyanka, you had a question and you wanted me to unmute you. I have tried to unmute you if you still have the question. Yeah, Priyanka, you can go ahead.
We are not able to hear you.
Yes, you're talking.
Yeah, can you hear me now?
Yes,
Yes.
we can hear you.
Yeah. Regarding the allergies, I mean, are there any multi-minerals, I mean, specifically which normally, in a normal case, like certain mineral deficiencies which cause allergies?
Technically, no, it does not cause mineral deficiencies do not cause allergies. Nutritional deficiencies mimic the symptoms of allergies, but they are not allergies.
Okay, thank you.
Megha, you can go ahead.
Hi, Mansi. Hi, Dr. Chinar. Hi, Mithun.
Hello.
Hi. So, I have a Siberian Husky, and he was. We got a PCR done because he was having in 4DX rapid card. He was detected with E. canis. So the doctor prescribed doxycycline 2 weeks because none of the clinical symptoms were being shown in the blood report. And we got the PCR today, which shows negative for all strains. So I just wanted to understand from Dr. Chinar if you still think that we should go ahead and give him doxycycline for 2 weeks.
So very difficult question when the reports are confusing. I usually believe the PCR because it is more let's say it is more, what do you say? It is more
Accurate.
what's the word? Specific. It's more accurate. It's more accurate than the snap test that you are talking about. But you should check your dog's platelets because with sorry, which was the pathogen that you talked about? He said what? Alicia, you said?
Canis, yeah.
E. canis, yeah. So with Alicia, your platelets are going to go down. So if his platelets are less than 2 lakhs, then yes, you should give him doxycycline, and I would say that you should give him doxycycline for 3 weeks. But if his platelets are within the normal range and the PCR is negative, then you don't need to give him doxycycline. Is he showing any signs of tick fever?
No signs. Platelet count 2,64,000.
So it's on the bot. It's a very catch-22 situation, right? Because 2,64,000 is borderline low. So lay low. There is no harm. There is no nothing. It's not going to like harm your dog in any way. And if your doctor suggests that you should take it, you take it.
I'm going to visit him once again tomorrow morning because he has a sensitive gut. So I don't want to kind of, give so much of antibiotic if it can be avoided and it won't be a risk for him. Because
Yeah, so
otherwise,
you can also wait for about a week and get his blood work done again. Until then, just keep him on supplements to help increase his platelets. So those supplements will not create any issues with the gut. So something like Setplat, or give him a little bit of papaya extract. Setplat is papaya extract, but I was talking about actual papaya extract. Give him that and repeat his blood work in 1 week and see if the platelets are coming up. Then you don't give anything.
his complete blood work. Blood work is absolutely fine. I mean, there's nothing which is below or is high or is low. Everything is within range, and his appetite is absolutely fine. His activity level is absolutely fine. Um, I mean, so it's just, and purely PCR is also all negative for all strains. It's just that 4DX test.
So 4DX is a little less accurate anyway. So just keep an eye on him. Don't medicate him as of now. Observe him for a week. If you're seeing any signs, then yes, I would say that you get the CBC, just the CBC done once more. But yeah, it it's a difficulty है. Because वो बैठ जाता है ना दिमाग में कि oh shit, उस पे तो positive आ गया.
I
So
know I've been trains on this for the past 2-3 days, and he's been the one guiding me to do this test, this test, this test. So it's just that today we got stuck on the fact that the PCR is showing all strains negative. So whether we should go ahead with it, because Mithun has helped a lot on the gut part for him, and he's reached a point where I mean, because the doctor did mention that it is either the till we were awaiting the PCR, that either the tick fever is just the initial stage or it has passed away, because he's showing antibodies in the rapid test. So that was the only confusion. And Mithun said that he also feels that he should not be giving doxycycline, but he wants me to go as per what the vet says eventually.
So
So
it's a very catch-22 situation, because his platelets, they are well within the range, but they are towards the lower side. You could very safely wait if he has no other signs and symptoms. You can wait for a week, get just the CBC done again to see what's happening with the platelets. If they're increasing, then I think you're good without the doxycycline. If they are decreasing, then I would also say that you take the doxycycline, because tick fever ek bar ho gaya, then that's another aim.
He's
No,
had
no,
tick fever now 2022 June.
when he was
Yeah.
1.5 years old. So
Yeah,
This is
fluent
something
alphabet
that
at the same
we as vets are extremely scared of, because we've lost a lot of. I don't want to talk about that. Like, just wait for a week, get the CBC done again, and your solution is simple. If platelets decrease, take doxycycline. If platelets increase, don't take doxycycline. You can wait for a week.
because if they are around what it is, then it's fine. Then also I mean I can kind of wait.
Then also you don't need to take. Yeah, if they decrease, then you should be concerned.
Okay. Thank you so much, Dr. Chinar, and thanks. It was a very, very helpful session. Though there's a lot of stuff that I didn't understand because of the terminology, maybe, but it was a very, very helpful session for a lot of things. Thank you so much.
Okay.
You.
Awesome, guys. I think it was absolutely great. And thank you so much, guys, just sticking around here till the end. It's almost 10 o'clock. Not sure if everybody's had dinner here, but
Dog is
yeah,
also
so-
waiting.
yes, so we'll end the session now. Please do copy the code and go ahead and shop. You can buy some Huffed products. They are helping us with these sessions. So yeah, thank you so much, guys. Let's looking forward to having you guys again in the next few sessions that we're going to do. Thanks. Bye.
Thank you so much.
Thanks,
Thank you.
Mithun.
Thank you. Bye.
Thank you
Bye.
everyone.
Thanks.